Things about newborns that nobody tells you from a labor postpartum nurse. Number one, they might have purple hands and feet. Not just at birth, it might continue for a day or two. This is something called acrocyanosis, and it's completely normal. The baby goes through a pretty big shift after birth. Previously, it had fully relied on you and the placenta throughout all of the pregnancy. And then baby's born and baby needs to take over. So there is a massive shift in their vasculature and how their lungs are functioning. Their body is mostly going to focus on sending blood to their trunk, their vital organs, their brain, and then it sort of makes its way to the hands and the feet later in the process. They're not cold, just looks a little strange. Number two, your newborn may have acne or rashes or stork bites or other things on their skin that you just didn't expect. And again, those things are usually completely normal. At least in America, we kind of associate babies and their skin perfect and flawless. That's almost never the case. Let's give the babies a little bit of credit. They were inside of a uterus full of fluid for the better part of a year. And that's tight quarters, a lot of moisture for a long time. And either way you give birth requires a lot of strength, exertion on your part and your baby's part. They may come out a little roughed up, just like you. And most marks and rashes and other things you might notice on your baby's skin will subside with time. Some may not, like a birthmark. If you're unsure or if you have questions about it, just let your provider know. Number three, a term stable newborn eats a lot. They eat very often, but at the same time, they don't eat a lot as in volume. They eat a very small volume. A full-term newborn's stomach is very tiny. It's about the size of a marble or a cherry. So they do not need a very large volume of breast milk or formula at the start. Instead, they're going to have very small volumes and they're going to be eating quite frequently. Again, 8 or more times in a 24-hour period. Over time, as baby grows, their stomach will start to grow as well, and then you'll notice the baby taking in a larger volume. Number four, your newborn might go cross-eyed. And they may do it a lot. In most cases, this is completely normal. They don't have great eyesight. They can only see about 18 inches in front of their face. Learning how to focus, follow things with their eyes are all developmental skills that they learn with time. And those eyes will kind of get a little wonky and it's a little strange at first. And number five, newborns are pretty noisy. They sneeze, they hiccup, they snort, they squeak, and they do these things awake and asleep. We're so often given this image that newborns are silent, sleeping like a baby, but they make noises. They're pretty noisy little things, even when they're not crying. Usually it's completely normal. As always, ask your provider if you're concerned. These normal newborn sounds are going to be very different than a baby that's distressed, having trouble breathing, grunting, or working hard to breathe. For more information on pregnancy, birth, postpartum, babies, give me a follow, check out my page.